Hello, good morning. Hello, anyone there? Can you hear me? Hello, hello, can you hear me?
Yes, miss.
Okay. Can you all see my screen?
Not yet, miss.
Okay.
Now okay.
Okay. So today also we are going to see under the assessment process in health and social care settings. So these are our learning objectives. Today we are going to see the terms. Wait. We are going to understand the terms or the difference between integration, cooperation, and partnership. And the importance of today's session is, so we are going to see regarding some importance, right? So here were partnership working. So the today's main focus going for the partnership working. When we talk about the health and social care sector, this partnership working is very, very essential. Okay. So, and the partnership means each and every personnel or the individual who are involved in the care program or the care provision. So they are having some kind of relationship or the partnership. So that partnership, it could be between the nurse and the patient or the client or the other healthcare professionals and the client or between the healthcare professionals. And when we talk healthcare professionals and their community, families, or other relatives or other non-related caregivers, so there are some partnerships or the relationship will be developed once the care profession started to program. So each and every relationship, it's important when we are talking about this, uh, when we are talking about the care program development, right? So today we are going to briefly, we are going to see briefly regarding the importance of partnership working with the client and with other healthcare professionals and with the families or the other caregivers and the public. And in addition to this, we are going to see the characteristics. So when we talk about this partnership working, if a partnership working to be a effective one, so what are the characteristics it should encompasses? So those things we are going to see, and we will understand the benefits of partnership working in different levels. Different levels means when how it will be helpful or how it will be beneficiary when it comes to the interpersonal level between the personals, and how it will be when we are talking about the organizational level or institutional level. And finally, we are going to analyze how this partnership work could be positively supporting the assessment process. So When we are talking about the assessment for gathering the informations, so working partnership with these personals, how it will be positively affecting the information gathering. So these are the learning objectives of today's session. We will see one by one. First, we'll see the meaning of integration, cooperation, and the partnership. So, more or less, the meaning are similar. When we talk about integration or cooperation or partnership, so more or less, the three terms are similar, but we can differentiate with some minute with some, there are some kind of differences are there, very minimal differences. Okay. Integration means it is a combined set of methods, process and models that seek to bring about improved coordination of care. So here, when we talk about the integration, it is there are some, we are set outing some models. So we studied there are different types of models we are using for the assessment process. And for getting the assessment, we are using some kind of methods, and there are some sequential steps we are using. So all these models, process, and even the methods, they are combining. So we put all together at one part to develop and to improve the coordination of the care. So that is, we are telling it as integration. So integration mainly focusing on the available, the applications. Like, so we are studied various theories, models, concepts, and process. So in integration means we are going to apply all the studied models at once, or we are combining the models and sets into one category, and we are applying them in our routine practice to support and to improve the care profession. So that is, we are calling it as integration. When we talk about the cooperation means it's little bit more, like when we are going to have some kind of relationship, or we are going to put hands with, or we are going to join hands with other organizations like public organizations. It could be a private sector or public sector or agencies. So likewise, we are going to have some kind of partnership with the public organizations and institutions to ensure a focus on the care and support and health related needs to their local population. For example, cooperation means when we talk about the private, public sector or private hospitals or public hospitals, they are having and they are working in a joint hands with some private pharmacies, pharmaceutical companies or agencies. So where they are receiving all the medicines and other equipments they are needed for the care professions to the patients. Okay. So it is, we are calling it as cooperation. Or when we talk about the private hospitals, some hospitals, they are joining or they are working in a collaboration with the foreign sectors or the foreign private hospitals, where they are gain or where they are getting equipments and the medicines and other needed resources for the care profession of their patients. So it is, we are telling it as a cooperation. So simply cooperation means they are having some legal connections in order to gain beneficiaries from beneficiaries for their local populations, right? But partnership means, so it is differs from this integration and cooperation. How? The partnerships, both the parties who are involving. It can be or agencies, or it can be any two personals or the individuals who are involving in developing a care program. So both the parties involving in that care program, they are joining hands and they are working together to make all the decisions or the arrangements, right? So a joining working arrangements where the partners are agreeing to cooperate to achieve a common goal, create a process to achieve a goal, plan and implement a joint program and share information, risk and reward. So yes, that is partnership. So when you talk about the integration, so integration means under the integration only one person, the knowledge person or the skilled person, he or she may uh, collect all the models and theories which they were studied, and they are going to apply on developing the care profession. So there is no any commitments between the involved two parties, right? So whatever the knowledge they have in within them, they are going to use. And cooperation means cooperation also, not both the parties are going to involve. Okay, here one party, they are having some kind of legal connection. So cooperation actually it's a kind of legal connection, how one party is requesting something from another party. So they are under those peoples to, they need to provide some kind of statistics. Okay, when we are talking about the private hospitals who are working under another agencies. When we talk about any other public organizations, not both the parties are always going to put hands together. One party, they will request something from the another parties, then to fulfill those requests, the other party starts to work. So that is a kind of that kind of relationship, we are telling it as a cooperation, right? But partnership means the involved both the parties. It could be an agency or the personnel, or between two individual or between two teams, whatever. So all the individuals or the personals involving in a particular care programs, each and everyone should have an accountability and responsibilities and duties to make the success of their plan. That means they all the people in a particular they all the people, they have some kind of commitment. So with the commitment, they starts to achieve their goal. That is, we are calling it as partnership working. So they will propose to one goal, and then to achieve that goal, each and every members in a particular that partnership working, they work collaboratively, and they will propose new ideas, suggestions, and then they will develop a kind of plan process to achieve that particular goal. That is, we are telling it as a partnership. So more or less integration, cooperation, partnership are similar, but the major difference is like this. Okay, in the partnership means all the people needs to be involved. Okay, this is, we are calling it as these are the definitions for these three terms. Now we'll see why the partnership working with the client or the patient is important. So when we take the hospital setup, we are addressing the people as a patient, or now we are normally encouraging all the people not to address them as a patient, to it is better to address as a client, right? So why we need to have a partnership working with a client? So first one, recognize the strengths and resilience of the clients and how these can be used to address their needs. So resilience means it is an action to overcome any kind of challenges. Or in other words, you can call it as flexibility or quick adaptation. That's we are telling it as resilience. Okay. So with the help of this partnership working, we can identify and we can recognize what are the strengths and what are the abilities of the particular client or the individual. Then only we can make our care arrangements according to that. So here, when you see a nurse and a patient are there, so there is a relationship. So first, the nurse, the nursing officer, she or he should understand and identify the strength and abilities and about the patient's body conditions, how they are flexible or not, whether they are sensitive or not. So those things they need to identify. So with that identification, they can develop a care program according to a specific individual. Okay. So all the proposed planning we can apply to the individual. Why? Because each and every people having different kinds. They are differ. Okay. So they are unique. That is the major thing. So each and every individual are unique. So for that uniqueness, we need to identify their unique strength and abilities. Then only we can plan the management, and also it will be helpful for us to address their needs. What are the immediate needs? Why? Because the client may have some immediate needs. They are expecting to fulfill those needs. So without addressing those needs, and if you are going to provide a care for an unnecessary needful things, then the care profession and the achievement of the patient, the goal that you have planned, all will become failed. So when you are working in a partnership, then it will be easy for you to identify and understand these things. Then it recognize people expertise. Yes. So people expertise means, so it could be helpful for the professional development as well. So when you are working in a partnership, then you as a nursing officer, as a healthcare professional, not only nursing officer, as a healthcare professionals, you can identify what are the skills and abilities you are having. So if there is a situations you need to convince the client for the surgery, then how you are communicating or how you are making your client to convince for the surgery. That means your ability, your communication skills, how you are going to communicate, what are the things and what are the important things you are going to tell to your client in order to convince. So those things. So it or not on when you are working with the client in a partnership working, so those qualities you are going to, as a professional, it will be helpful to develop you as a good professional. So it that is, we are telling it as it can recognize people expertise. Okay. And empowers clients to become actively involved rather than passive recipients of their care and support. Yes, so it is common. So from the beginning onwards, we are seeing that when we are providing any kind of care, normally the care that is available in the health and social care sector, it is a patient centered or a person centered care. So whenever you are providing a care to any kind of individual, the care that you are going to provide cannot be a long lasting. That means it cannot be going throughout their lifetime. Okay. So within the period you have planned for the care, in addition to providing or in addition to making an individual to heal their problem, your care needs to make them to become independent as well. Okay. So if you plan to make your individual to improve their health status within 1 month, within that 1 month of period, you cannot make your client to be a dependable one on you, right? So your, in addition to the healing process, so within first or within 1 or 2 days or within 1 week or 2 weeks, yes. So until they regain their capabilities or until they regain their own self confidence, you can be you can make the person dependable on yourself. But having that dependency throughout the healing process is not good. Why? Because you can't helpful or you can't provide those care the rest of their lifetime. So that is another important. So when you are working in a partnership only, you can impose all these things into your patient minds or the client's mind. So and your actions. So you can help your client to regain their confidence to become independent. So otherwise, the person or the people who you are going to care become recipient on you. The recipient, passive recipient means they're dependable on you. Okay. So you can provide whatever the care and support for their healing process, but you make sure in addition to that, your care and support won't make your client to be a passive recipient or the dependable on yourself. Okay, so it is important. It can empower, it can encourage the patient's capabilities or confidence when you are working in a partnership. Clients have rights to consultant. Yes. So each and every clients, they are having a rights to consult with you. That means they can have some chat and they can have some kind of discussions to develop the care program. Okay. So this discussions for having a effective care program will be gained only with the partnership working only. Why? Because when you are working as a partners, both of you are having a chance of sharing your knowledge and informations, right? So if there is no any partnership working, only one kind of working, that means only there is one authority power and you are the one going to order all the things, then there is no any chances of sharing information and suggestions, because compared to your ideas, sometimes the patients may have some carrying ideas, because the patient only knows about his or her body conditions, her mind conditions. So when you are working, both will share your informations, then you can come up with a new idea. So the and it is a rights. Okay, you can't impose any of your ideas. Patients or the clients, they are having a rights to consult about their situation. Then person-centered approach, obviously you all know what is this person-centered approach. In previous lessons also we studied lot about this person-centered approach, and when we are talking about health sector, actually it is a patient-centered approach caring programs are available. Okay, there is no any professional centered approach, and gives everyone involved ownership and clarifies each person roles and responsibilities. Yes, and when you are working with a client, you as a professional, you also identify what are the responsibilities and roles you are having as a professionals, right? If you are not working in a partnership with a client, then you won't understand actual responsibilities. Okay, when you starts to work with other person only, you may encounter what are the problems or the what are the issues that you are having as a professional, as a role. Okay, then you can identify those problems and you can improve yourself, right? Enables clients to declare their rights. Yes, so the clients, each and everyone, they are having different rights. That means a basic human rights. We studied in our previous modules what are the rights of each and every person and each and every client having, right? Like, right, they are having right to refuse any treatment, and before any treatment they have the rights to consent and consult, providing consent, and you can't compel any individual to provide the consent for any kind of management. And also they are having a consent to involve their family members or their friends into the caring profession, right? So those things they are having. So these are the basic rights, right? And each and every client having a right to respect and right to maintain their privacy, confidentiality maintaining, all the rights are having. So when you are working in a partnership only, the clients, they may have some kind of, they can able to access all these right. If they are not like the treatment, they can refuse. Okay, you can't complain the patient that they are refusing the treatment, because they are having the right to refuse the treatment. Okay, so these things will be developed one when you are going to work in a partnership manner. It is inclusive and has the potential to prevent clients from become marginalized. Yes. So with the partnership working, we can inclusive. Inclusive means, yes, we can include the patient also in the caring profession. Sorry, caring profession. Okay. So it is important. It is mandatory to include even each and every person in their care planning method. Prevents health professionals from imposing our own views and ways of doing things for clients, and helps to equalize the balance of power. Yes, so if you're not going to work in a part, if there is no any collaborative working, then the healthcare professionals, they think that they are having a high power. Okay, and the patients, they may think that, okay, they may develop a kind of thought like what, so they are a needy persons, without us they can't do anything, so they actually they need our help. So in that manner, we are having a high power, so we can order anything to do them. So it is a kind of thought, it will be developed automatically when there is no any collaborative working. right? So if the each and every healthcare professionals develop such kind of thoughts, then the care and the quality of care that they are going to provide is not the it's in not it is the quality is not a good quality, right? It is a very very bad because they are not considering the patient concerns, desires and wishes. Only they are thinking that they are having a high power and they are in a higher positions, so they only have the power to order whatever they are ordering the clients needs to do. Okay, so then the each and every healthcare professionals they starts to prepare their own care activities according to their will and wish. They are not considered about the patient side. Okay, but if you start to work collaboratively, then there is no any uh, I mean there is no any power differences, right? All will be equal. Although you are a healthcare professional, you are a knowledgeable person, yeah, you can't feel or you can't express those activities on your care. Why? Because all your focus will be on improving the or enhancing the quality of life of your patient or the client. Okay, so you are expecting that your client needs to tell that you are a good caregiver or a healthcare professional. Your care is a very very satisfactory. So those words you are going to expect when you are starts to work, because your mind and the thoughts and the environment going to change yourself. So you can have or you can develop changes within yourself. So that is important, right? So it prevents the so once you start to work in those manner, you won't have any impulsive actions. That means you won't impose your views, and it is not only for the physical care but also when we are talking about the religious views. That means the spiritual activities also, like because patients may comes from different kind of ethnicity and the religious view, and you may have some kind of religious views, so you can't impose your religious views on the patients, right? So you need to accept. Once you start to work collaboratively, you can you start to accept the patient's religious views, and then you can help them to promote those religious views as a caring profession manner, right? So that's why the partnership working is important with the client. And some partnership working is a legal requirement. Yes. So when we are talking about this Mental Capacity Act referral, that means the people who are unable to make their decisions on themselves. In that manner, if the person is a very lonely person, there is no one to look after them, then as a healthcare provider, you can make decisions on behalf of them, because we studied this mental capacity acts and the policies, what are the guidelines they are having, in which instances we can make the decisions on behalf of the clients. Those things we studied in detail. Okay, so sometimes this partnership working will be like a legal manner. So once it becomes a legal manner, that each the particular in healthcare professional is only the accountable one. Okay, she or he should take all the responsibilities. What are the decisions they are taking on behalf of that particular individual? Then it enables to understand, respect, and values each other's perspectives. Yes, not only the patients, and also it can help to respect and providing some kind of values to the healthcare professionals' ideas as well. And it enables to make personalized and appropriate responses when meeting the people. Yes, so that means a kind of person-centered care. So these are the actually these are some kind of benefits, right, we can gain from developing the partnership or the collaborative working with a client. So that's why we are studying here. These are the important. So and the basic or the all of these benefits, so all of these importance is going to have or it's going to provide one major good thing. That means, or when you are going to work in a partnership, then actually you can gain maximum information from the client or the patient. That is one important purpose. We are going to develop the with a client would be helpful in the assessment process, right? Because we are studying regarding the assessment process. No, so if you develop a partnership or the collaborative, if you start to work collaboratively with your client or the patient, then you can automatically develop a good knowledge and you can discuss more and more about your patient and maximum informations you can gain from your client. So why those maximum informations, the gathering or the assessment is important? Because not only for the current management, but you can have those as a legal documents to plan for the future management as well, right? So that is the basic concept or the idea which we are having to follow all those activities, right? So this is regarding the importance with the client or the patient. Are you all clear up to now, or do you have any doubts?
No doubts, ma'am.
Okay, thank you. Now we'll see the importance of partnership working with the healthcare professionals. Among healthcare professionals, right? Like doctor, nurse relationship, doctor, that means within nurse, when we are talking about the nursing officers, there are different levels are there. The normal grade one nursing officers, then ward in charge, they are grade 2, and the matron, they are administrative levels like matron. So normally in the hospital setups, once you encounter, there are uh, some officers in the hospital, I'm telling, they are wearing a blue color frock with a large weight. That means the cap is very large. So they are, we are telling it them as a matron. So they are not, they are the higher power. So when we are talking about the nursing setup, nursing administrative setup, they are having the higher power. Okay, the chief nursing officer or the matron officers, so they are normally wearing the, there is a, the differentiation is they are wearing the blue color frock like, okay, not the other normal nursing officers. And they are related to the administrative works like other management purpose, administrative works they are handling. They are not coming for the in the normal routine ward setup. And there are sisters, ward sisters are there. They are wearing a the same. They are also wearing the same cap like the matron, but the color of the uniform is different. The nursing sisters, they are wearing a pure white. Okay, and other the small, the junior staffs, they are wearing like a pinafore and the cap that you can obviously encounter those peoples in our normal setups, right? So there are different levels are present. So each and every levels of nursing officers, they needs to be work in a collaborative manner. So it is one side. When we are talking about the doctors, yes, even the doctors also, they are having a consultant, registrar, then the normal training, that means the intern officers and the medical officers, senior house officers. So among themselves, they are having a kind of partnership or the collaborative working. Other than that, there is a collaborative relationship between the nursing officers and the doctors. So apart from that, other paramedics like medical laboratory technicians and the radiographers who are taking x-rays and those things. And for the physiotherapists who are responsible for these exercises, and then pharmacists responsible for the manufacturing medicines and providing medicines. And other than that, speech therapist or the audiologist, or the audiologist means who are responsible for the hearing problem. So if we are having any hearing impairment, they are responsible for instilling that hearing devices, okay, ear devices. And when we are talking about the speech pathologist, if we have any speech problems, if we are unable to talk, then they are to they are trained to regain our speech. So speech pathology. So here, when we take a hospital setup, it is a kind of multidisciplinary team. Multidisciplinary team working means different disciplines people are involved in. Multidiscipline team. Okay, different kinds. Discipline means we are pointing the disciplines like different areas of people like doctors, nurses, physiotherapists. They are different departments of people, right? So disciplines. So for improving one individual's care, there are, it could be a multidisciplinary team. Not one healthcare professionals can't do all the things, right? So you can say that, okay, the doctors are there, doctors are enough to do all the care. Not like that, because doctors, they are having a different role. The once you reach the hospital, doctors, they will take a full history from you, and then they will identify what are the problems you are having. Then they will prescribe the test. Okay, you go and take the test. So then you need to come for the nurses. The nurses are the responsible one for taking the blood sample. But here the doctors, they doesn't know how to check. That means how to check, and the nurses also doesn't know how to take all the components separately and to identify what are the problems, right? So automatically we are sending all the samples to the laboratory. So there are medical laboratory technicians are there. So they are trained for these activities, and they will separate with their equipments, and they will give a report. So the nurses and doctors, they only know to evaluate, to analyze the report, but they don't know how to separate the components in the blood, and how to take the needed components. Those things, it is separated for them. And when we talk about the pharmacist, we only know the actions, and both the nurses and the doctors, we are prescribing, right? So we only know what are the tablets, means, okay, this tablet, Panadol, we are giving for the fever. So only, but how we are preparing the Panadol, what are the components or the constituents we are including, we doesn't know. Okay, it belongs to the pharmacist. They are the only knowing person. And when we talk about the X-ray taking, so okay, radio, we only know once we get the X-ray report, okay, we can, even the doctors and nurses, we can go through the that report, and we can identify, okay, what are the abnormalities present in that person. But keeping the machine and taking and keeping, or the positioning the patient, and the amount of radiations they need to insert into the patient body, all the things known by the radiographer. So not one person can enough to improve the health status of any individual when we talk about the health and social care sector, right? So each and everyone are specialized. They are expert in their departments and the specialization. So we all need all the people to incorporate to develop the health of the people. So for that, we need a partnership working, a collaborative working. So now we'll see one by one what are the importance. Yes, it prevents the isolated working environment. So it's obvious, right? Actually, we can't have an isolated environment, working environment in a hospital, and that means in the health and social care sector. However, it is not possible to have that kind of isolated environment, because each and everyone are dependable. Clients are dependable on healthcare professionals, and each and every healthcare professionals are dependable on each and everyone. Okay, so it is not possible to have the isolated environment. Sometimes protect from being vulnerable or at risk when there are personal safety issues. Yes, sometimes even the healthcare professionals, they also have some kind of risk, and also there could be, they are vulnerable. So when we are working collaboratively, we can prevent these activities, right? Prevents us from being inward looking and task oriented, and to focus instead to see the individual as a person and be person centered. Yes, so it is another thing when we are working in a collaborative manner. So actually, the normally when you talk about the banking staff or other companies, they are task oriented, right? So the higher management, they will provide a kind of task. So within 1 year, you need to complete these projects, or within 1 month, you need to complete these projects, or the task you need to. So they are working, normally they are working on a task oriented, right? So actually their work is like that. So they need to fulfill in a task oriented. Why? Because once they fulfill only, they can achieve their company goal. So they are running and running and doing all the things for not for their savers, for their sake, and not for the consumers or the customer sake, only for the task oriented one. But we can't apply these activities to the health and social care sectors. If we start to work as a task oriented, like okay, I'm a nursing officer, so what are my tasks? I'm coming, and normally we are telling as a in a ward we are having so many compartments, like so we are telling it as a cubicles. So one compartments there are 10 patients are there. So today I am appointed, or I am delegate to the compartment B. So I will look after only those 10 patients, right? So likewise, so that is my task. Okay. But that particular, I so think about myself as an example, right? So I can't work like that. Okay. I'm coming and I am putting my signature and going to my compartment, seeing the compartment patients and doing. So we can't do like that. Why? Although we are, although my responsibility to look after that compartment, I need to see other patients as well if there is any need. I can't say that I only oriented to this compartment. Okay, so that is not the actual way. Why we are delegating like that? Why we are having that delegation? Because to make the work easy, right? Because we are having lot of nursing officers, so only one nursing officer can't focus all the cubicles, because it is not a lazy one. Okay, it is not the it is not the easy one. Why? One compartment may have lot of patients, and each and everyone complaining different problems. So one cannot control whole ward. For that easy purpose only, and for the patient's sake, we are dividing each and every nursing officers to a particular area. But that means they are not only confined to that area. If the compartment C patient needs any help immediately, I need to go and look after and fulfill their needs. Okay, so that is the one. So that is we are telling that work, that means the healthcare professional workers, we are not the task oriented. Sometimes compartment C health nursing officer, she may inform me that I need to go home early because to look after my children, there is a problem in my house, so can you take my duty as well? So yes, we are doing in that manner, right? We are working in a collaborative. Then another day if I ask any help, then she can help me. Okay, so that is that quality will be developed. It should be developed. Okay, we can't neglect that quality. It should be developed in each and every healthcare professionals. Otherwise, they can't survive and they will put their life as well as the patient life at risk. Okay. Recognize the range of expertise and encourage a multidisciplinary way of working. Yes, so with the partnership working, we can have and we can identify. Yes, it is a good opportunity to identify our expertise, in which field I am expertise. Okay, whether I am expert in a leadership quality, or whether I am expert in a management, resource management quality, or in a patient-centered care. So what kind of expertise I'm having? So once you started to work collaborative only, we can identify our expertise, because we can encounter different personas within us, and then I can have some kind of measurements. I can have a measurements within myself that how I am working when compared to another healthcare professionals, or what kind of care I can provide to. So up to whether the patient is satisfied or not, we can have some kind of measurements or some kind of grading within ourselves. Then according to that grading, if I'm satisfactory, okay. If I am not satisfied, then I need to follow, or I need to look after what are the ways I can develop my professionalism. So it also will develop once you started to work as a partnership, right? then it helps to maximize the use of resources and to provide joined up services and coordinated responses. Yes. So once you start to work collaboratively only, you can have a resource management quality, right? So because sometimes once in a hospital setups, if you are working as an isolated person, you sometimes you are not get all the informations that you are needed. But if you like, I'm just telling as all the examples as a nursing oriented, right? Because normally the nursing officers are highly having more responsibilities when we talk about the that means ward setups, like they needs to manage the resources, and also they needs to have the leadership problem and also the patient care. So they are having different roles. That's why I am emphasizing the nurses as an example. So where as an example, we will take that uh, A. So there is a nursing officer A. She is responsible for the resource management. Resource management means she is the one who is looking after what are the stocks of medications we are having, that we are having separate drugs, right? Books, that means records, right? For the drug calculation and for the other liquids calculation. For, likewise, we are having different books. So we are appointing one person to look after those books. So she needs to be very accountable how much medication she received from the particular pharmacy or the management, how much they provided for per month, and how much medications we used for the patients, and what are the rest. So all the calculations she need to be have on time, right? At for month or for 2 months or for once in 3 months, we need to submit to that administration, the higher authority like directors and hospital directors. We need to submit all those things. Then only we can ask for, if there is any shortage of drugs, then with the proper calculated records only we can ask for the other drugs, the needed drugs. So we are appointing A as one nursing officer for look after those things, right? And we are appointing, there is one nursing officer B. She is responsible for looking after the patients in compartment C. Okay, so she is having 10 patients and she is looking after compartment C. And there is another nursing officer we are appointing for the food food serving. Food serving means she is the one responsible for identifying what are the foods that each and every patients are need, and to give a kind of proper foods to them. So there are three nursing officers are there. So I told you the maximize uses of resources means, so normally if you, so each and every nursing officers are appointed for the each and every task. So in that manner, they will use all of their abilities to complete that task in a proper manner, because they are having only that task. So A responsible for the resource purpose. She won't come and do other things. And compartment C, she needs to look after the patient care, right? So we are appointing like that. In that manner, we can make use the knowledge and the skills of each and every nursing officers effectively, right? Then the goal to achieve the particular goal also fulfilled. But think about the situation, there is only one nursing like nursing officer D. She is appointed for making the records of the medicals, and also she allocated for the compartment C to look after the patients throughout the day, throughout his shift. And also within that shift, actually within that shift, normally the lunch break will become, so she needs to prepare the food as well. So think about, although that personnel is having all the abilities and qualities, some while doing all these things, at some point she become exhausted, right? Why? Because working in a patient's mean it is not an easy way. They may have rounds, ward rounds, one consultant will come, then again registrar will come, nursing officers needs to go. So likewise, they will have lot of ward rounds and they needs to check each and every person's need each and every time. Along with that, then she needs to calculate all the medications and going for uh, uh, dividing the lunch. So at one point, actually, she become very, very exhausted. So if we continue to do the thing in a same manner, so the within the time, the quality of care and the quality of activities that she providing starts to reduce. Why? Because she starts to become exhausted. So she lose her interest time to time and her mind become like a task oriented. I need to fulfill this task. So she won't follow or she won't focus on the patient care. She only focused on her activities. I need to finish. I need to finish. Likewise, she starts to think, right? So we can't get the maximum resource from that particular person with the time. So, but when you are working in a partnership, like when you are appointing each and every person separately, and if they have a coordination between them, yes, you can use the resources actively. So, it is one example. Another example is, so as I already told you, so we are having separate three personals for three activities. So if so the medicine, the drug, the person who is dealing with the drugs, she is having all the documents and all the accounts regarding the medications. So the person who is carrying the patients, if she encounter any problems with drugs, like if there is no any drug availability, or if the drug, if she needs to get any drug immediately, then it will be easy for her to contact with the person who is having the drug work. Then she can go through your records and she can convey the message. No, no, we are having enough amount of drugs from the drugstore, you can take and use it. So likewise, we can have a communication. And also the diet person, that means the food serving person, she can make a contact with the particular that cubicle, the person who is carrying the compartment. Then she can gain that which patients having what kind of diseases and what are the foods they need. So then they can work effectively, right? Because not only one person needs to put all the efforts. So they can use all the resources effectively and they can work without a restless. Okay, they can work in a calm and quiet way. So that is major important when we are working in a collaborative manner. And it prevents the duplicate of services. Duplicate of services means providing a same care again and again. Why? If there is no any coordination or collaboration, everyone needs to do the same thing. So I already, one example, uh, normally as a nursing officers, we are having a shift works, right? 7 to 12, 1 to 7 or night shift. Likewise, we are having. So I am working as a nursing officer from 7 to 12 shift and I cared for one patient. She complained me that she is having very, very severe pain after the surgery. Okay, so what I did, I provided the care like that normally if we have any pain in the house setup, we are having some warm compressions like or the cold compressions. Likewise, I provided her warm compression and I changed her positions to ease the pain. And I provide a quiet environment to her, to a relaxed environment, and I ask her to listen to some relaxing musics, right? So these are the things I did. I didn't give any medications to her as a pain relief. I didn't give, right? So 7 to 12, I finish my shift and I off. Then again 1 to 7, another miss she came. And again this patient, the patient I look after, again she complained that I'm having pain, like that she is telling. So what she also going to do, she also starts to do the same thing what I did. Why? Because when we as a nurse in a nursing sector, the care, the management or the planning of care, we are having some kind of order. Okay, we need to follow that order. In that order, before providing any kind of tablets, we are looking if we can manage that patient problem in a conservative manner. Conservative manner like this, providing hot and cold compressor, changing the position, environment. So those things we are taking, that mild comforting methods we are providing. And if we are not going with correctly, then we are going for other methods, right? So she, because I didn't inform to the next shift means, so she also doesn't know what I did. So she going to do the same thing. So that is, we are telling it as a duplicate of services, providing the same care to the patient. Now the patient needs the tablet, pain reliever. Why? Because I already did all those things. She doesn't improve. Okay. So now she asked that pain medication. So if we provide the pain medication, yes, she can relieve from the pain, but she also failed to do that because there is no any collaboration between us. There is no any coordination. So as a correct way, before I leaving my shift, once she came, I need to submit all the things, whatever that I did to each and every patient. I need to convey the message to her. Then only she can work accordingly. So I just said it as an example, but actually it is not we are doing. So we are having a handing over, taking over, that each and every nursing officer, before they are leaving the setup, they need to hand over whatever the things they did to each and every patient. Each and every patient we are going and we are seeing, we are explaining the patient's condition, and then only she taking over. So we are having that. So that's why we are, that's why making the healthcare sector works effectively. If we had missed anything only, it making the patients as well as the professionals' life in danger, at risk, right? So with the partnership working, we can prevent the duplicate of services. Then it prevent and address the abuse within formal safeguarding and protection procedure. Yes. So even the healthcare professionals within themselves also, they may encounter some kind of abuse, verbal abuse or physical abuse, emotional, psychological abuse they are experiencing. Now itself, it's happening in some areas or some setups. So with this, we can prevent those activities, right? Enables to understand, respect, and yes. So when, like clients, we can respect, we need each and every professional, we need and we must to respect and value the ideas and the thoughts of other professionals' perspectives as well. Then it enables the organization to develop coordinated strategies, policies, and practice with each other. And also it builds a protective way of interaction. Yes, so it will help. So with the collaboration, we can develop a protective way of communication or the communication skills. And these communication skills will uh, destroy all the barriers that prevents between the healthcare professional. So the basic of the partnership working with healthcare professionals, it helps for each and every professionals to improve their professionalism. In addition to this, with the proper professional improvement, we can improve the quality of care of the patients. Why we all are doing and we are studying all those things, we need to improve the quality of care, the each and every client we are looking after. So if the care that we are providing, if it is needs to improve, then as each and every professionals, we need to improve our professionalism. So this partnership working will be more helpful to improve the professionalism in a health and social care sector. So are you clear up to now?
Yes, ma'am.
Okay. So far we studied regarding the importance of this collaborative working with the client and between the client and the professionals and within the professionals. And the collaborative working with the patient's family members or the relatives, other care providers is also important, right? So first one, it values the roles in providing care and support and acknowledge the skills and expertise which they have developed through their experience. Yes. So another thing, not all the time, all the healthcare professionals are not available for the care. So there are some activities we can we can give practice to the healthcare providers or the patient, the person who are looking after the patients, and we ask them to follow those things. In that manner, first you need to analyze whether the particular healthcare provider is having the ability to ability to provide that care to the patient, right? Because otherwise there is no point of training them. So once you started to train, whether you first, before start the training, you need to analyze that person. So how you can analyze? Just you can have some kind of discussion. So with the discussion you can ask about themselves, their abilities, you can find out and you can identify the knowledge about the particular actions they are having. Then you can have some conclusions whether the person is capable or not. If he or she is capable, then you can go for the training. You can practice them. And again, you can ask them to demonstrate it to you. And if it is okay, then you can allow the person to do all the things to the patients, right? The normal caregivers, right? Because we can follow this in the hospital setup, and sometimes the person we need to look after in the home setup, the nurses and doctors, they can't go time to time, right? So in that manner, you can train the family member who are very close to the patient and who are going to look after the patient in the home setup. Then you can provide all kind of knowledge and training, and you can train that particular individual. So for that instance, we need to work collaborative. It sees what they do as work rather than just seeing paid workers as contributing to the quality of care people receive. Yes, so uh, another thing is the caregivers, the home-based caregivers. You need to check whether they are working similarly, like task oriented, or actually they are working with the patient consent. So task oriented means normally help the caregivers, we are paying, right? The family members or the needy person, they are paying, they are hiring for the pay. So in that manner, you need to check whether they are working only for the money or they are working with the concept of patient-centered care. Enables to see clients and their care providers in the context of their families and communities rather than in isolation. Yes, so you need to, when you are having a collaboration of the family, you can identify how the family members are treating the patient, right? Whether they are involving the particular patients in whether they are including or whether they are discriminating. Okay, because actually it's happening for the elderly people. If the elderly people are there, some family members, they won't look after them, they won't included them into their family members. They may left home alone once they are going out, or they won't included in the family functions, they are not providing any good foods. It's actually happening in the current situation also. The uh, uh, daughter and son, they are doing to their parents or they are doing to their grandparents, like this. It's actually happening in some setups. So in that manner, the partnership working, we can identify how the family members actually treating their patients, the particular patients, right? Then we can have some idea, okay, they are including themselves as an individual into their community, right? So that we can identify. Enables care providers right to be exercised and their voice to be heard. Yes. So care providers, in the sense, we can have a people who we are hiring for the money, and instead of that, we can tell care providers for the family members as well. So in that manner, we need to check whether the care providers' rights are respected in a respected manner, or they are respectable, or whether they are having any violations, like that we can identify. Empowers them in their own rights and empowers them alongside those they support. Yes. So with that we can empower each and every caregiver to support for the client, because we need to provide they can develop a confidence in their work. Once they develop their confidence in their work only, they can support throughout the care program. It is inclusive and has the potential to prevent care providers, family, and others from becoming separated from their community and social networks. Yes. So working with the family also, we can help them to identify, because sometimes the society, the activities of the family members may make the society or the community to become separated, or they may make the family to become a isolated one. So we need to check whether the society going along with them or not, or the activities undertaken by the family members are acceptable to the society actions, or they are going against to the community principles or rights. Likewise, we need to check. And it also, yes, enables to understand, respect, and values of each other's perspectives. And we can make a personalized and appropriate responses to meeting the needs of the patients when they are working with their caregivers. And also we can enable to recognize the strength and the flexibility and the abilities in people's families and caregivers, whether they can flexible to the patient care, and whether they can live, and whether they can improve the quality of survival rate of the care receivers as well. So how we can achieve all these things with the collaborative work only. So this is regarding the importance of partnership working with the family members. So are you all clear up to now regarding the importance of partnership working with the family members, uh, professionals, and the clients? Or do you have any doubts?
No, ma'am, I'm clear.
Okay. So what about the others?
I'm clear, ma'am.
Okay. Right. So we'll move to the characteristics. So if your partnership needs to be very, very effective one, a good one, what are the characteristics it should possess? So that means if you have a good relationship with any of the members I explained to you, so what characteristics your relationship should possess? First one, it should be simple and clear vision that express the purpose. Yes. So why you are, so when you are developing a partnership, so what is the purpose? Why you develop this collaboration with this particular person? So those purpose should be very, very clear and simple. That means both the parties involving in that relationship should understand what are the purpose, what is our purpose, okay? Why we need to do these things? What are the things we need to achieve our purpose? So if it is simple and clear only, both the parties can involved in a they can involve fully, right? They can provide both their cooperation completely. Active members who know their roles. Yes. So each and both the part. I already explained that partnership means both the parties involving in one work. Each and everyone should be involved. There is no any power differences also. I am high power. I can't do those things. I am only ordering. So there is no any imbalance of power. All the parties involving are same, and all are having one, they are developing one goal, and they starts to work according to achieve that goal. Okay, so that is the partnership working. So if in this case, each and every members, they should know their roles. So they should be very, very active, and they needs to know their roles and responsibilities when they are engaged in a collaborative work. And the leadership of respected peoples, yes. So they can have some leadership quality, but not a ordering line. So leadership means it is not coming on the side of ordering. So you can lead the people. When you are working collaboratively, you can lead the people who are in other people who are involving in a correct manner, right? Like you can provide your suggestions, and if there is any problems with others perspectives, you can find out the solution. So you can lead other personas in a good manner, but you can't order or you can't impose on your own perspectives on other people's with the leadership qualities, right? So it should be a respected one. And yes, the decision making should be collaborative. Like collaborative means all the involved personals, they can put with their thoughts and perspectives, and analyzing all the thoughts and perspectives, you can pop out with the new idea or the new decision. So the decision making should be collaborative. It can't be how can I say it, it should not be a discriminated way, like that. It should not uh, only one side. Okay, so you need to analyze all the ideas that are coming to you, then you need to come out with the common idea which can't affect any of the partners involved in it. And the plan of care, it should be easily understandable and it should be easily accessible, right? The care, the services, the plan of care, whatever you are developing, it should be easily accessible to each and every personnel. And financial transparency, yes, you need to be economic. That means cost effective. Whatever you are doing, it should be cost effective, right? So you can't put all the you can't have a big budgets and all those things. Whatever you are doing should be budget friendly. An approach that shares knowledge and develop people skills. Yes, whenever you are in a collaborative, you need to share your informations. Whatever the informations you gain, whatever the skills you practice, you need to share with others. And the clarity of responsibility for the specific of implementation. Yes, yeah, you need to have a clarity, clarified responsibilities when you are working, and aims and goals that are smart. So smart means you're so you're formulating or you are coming out with one goal and aim. So whatever your goal and aim, so those goal and aim, it should be specific one, and it should be a measurable one. That means uh, what the outcome, it could be measurable. What are the outcomes and how it can uh, mm, give good activities, likewise, or how it can provide a good outcome on the particular individual, and what are the achievements. So likewise, it should be measurable, and whatever the goals and aims you are formulating, it should be achievable one. Okay, non-achievable one, not necessary formulate. And it should be relevant to the needs of the patient, or it should be relevant to the field. Whatever you are expecting, it should be relevant to that particular field. If it is a patient one, it should be relevant to the patient care or the patient needs. And the time management. Okay, the time management means it is better to manage the time effectively. So you need, whatever the goals you are making, you make sure you need to achieve it in short period of time, right? Not to drag for too much of period. Okay, so with the when you are developing a effective partnership only, you can have this. So whenever with the collaborative works, when you are developing aims and goals, it should be contain this smart approach. So if it is a smart approach, yes, then you are having an effective collaboration, because all these characteristics are simply explained by this smart approach, right? So this is regarding the characteristics of a partnership working. Then we'll see the partnership working in different levels of healthcare. So So how this collaborative working going to provide benefits, or how it's going to impact or affect the different level of healthcare. So in the different level of healthcare, here we are going to see mainly two levels. One is interpersonal level and other one is the organizational level. So interpersonal level means it is between the client and between the professionals, whatever we study. The importance also coming here, right? So when we are telling the interpersonal level, it is helps to convey the desires, wishes of each age groups of people more effectively, right? So when you develop a organ, that means collaborative working, you can get more detailed desires and views of each and every group separately. So because childs, they may have different ideas and desires. Middle age groups, they have different desires. Elderly people, they may have different desires. Okay, so you can when you are planning your care, you can use the same approach for each every group of people, because you need to analyze their desires and needs separately. So this collaborative working will be helpful for fulfilling that manner. Working in groups make it easy for them to ensure that they, yes. So when you are working in a group, then each and every person may have some kind of thought that they can understand the other persons easily. And also you can have an access for the social and public healthcare services easily. Why? Because you are having a collaborative work, then you can identify what are the services available, how can I access, because you can have an access to communicate with the wide area, right? A broad spectrum. So it will be helpful for to gain a healthcare services effectively. And also it helps to avoid the conflict when you are having an ideas and actions. So it is an interpersonal level benefits you may have, or you can gain when you develop a collaborative working. Sorry. And when we talk about the organizational level means institutional level. It can be a hospital, or it can be even a ward setup. Ward setup also, it's a kind of organizational level. Ward setup or the unit setup, uh, hospital level, or any other institution level. What are the benefits? So first, you can ensure the best possible support and care. Yes, you can confirm that to the public or to the society, a best support and care is provided through by this organization. And also it helps to learn and understand the goals of the organization. Then it will be easy for you to work towards to achieve that goals. And it will be promote the equal opportunities and respecting the diversity. And it can respect and maintain the dignity and privacy of each and every individuals by formulating various policies and procedures which will be helpful for them. And also it can help to report dangerous, abusive, discriminatory or exploitative behavior or practice if any individual encounter, by having or by developing a different or collaborative structure. And also you can share the knowledge and respect others' views to achieve the positive outcome in order to promote their organizational reputation, right? So these are the two levels. Mainly we are focusing on the healthcare which are available, which will be a beneficiary when we are working. So when you are starts to work in a collaborative manner, so these are the points that even it is in an interpersonal level or the organization level, you can get as a benefits, right? So are you all clear up to now?
Yes, ma'am.
Or do you have any doubts?
No.
Okay, thank you. And this is our final part and a most important part as well, that how a partnership work. So far we studied that what is this partnership means and what are the importance of partnership when we are talking about different personals and how this partnership providing benefits to different levels in a healthcare sector. And now we are going to see how this partnership is going to influence positively when we are talking about the assessment process. Why? Because our this module is mainly focusing on assessment, the gathering the information. So how this collaborative work going to helpful in gathering informations and supporting, right? Working in partnership with healthcare professionals, families, and friends will give a better understanding of what care that each and individual needs and whether their needs are met or not. Right? Yes, it is important. So once you started to have a collaborative work only, you can identify about a particular individual. So if you have a good collaboration with the individual, then individual tells a set of informations to you. And one step above, if you develop a good relationship with the individual's family, then they will say a set of informations which are not provided by the individual. So in that manner, you can gather more informations from a particular individual's background. Then you can develop a plan of care according to that. So in addition to that, we can understand what the individual is going through now. What are the needs? Okay, if you identify the needs, whether the needs are met or not. So those things we can identify. So we can gather it from a individual or the patients with the collaborative working. And yes, able to gain more information about the individual, the organization will be able to build a better services, and also it has the impact of person needs on his or her independence, daily functioning, and also we can evaluate it how the quality of life through the care that we are providing. And working in partnership with other healthcare professionals will ensure the clients using the services productively. Yeah, yes, like having a collaborative work with the social welfare services, you can identify whether those welfare services are used by the patient or not. So likewise, we can identify whether they are using the services productively. Sometimes for some instances, some patients may referred for the physiotherapy, for some exercises. If they have any fractured in their legs or arms, then for the improvement, for the regaining, we will refer the doctors or the nurses, they will refer for the physiotherapists. So if you have a communication or the contact with them, then you can identify whether the patient is using them productively. So if there is no any proper usage, then you can identify those issues and you can talk with the patient why they are not using properly, and you can come up with any other new solution. So for that purpose, we are having this collaborative work. When working with family members and close relations, much more information could be gained about the client, which provides more detailed understanding about the client's needs and the situations. And also it will be identify the service options that are available for managing the care of an individual. Yes, so this collaborative works, the individual can identify what are the different available resources and the care services are available for his problem. And also the other healthcare professionals, they also identify what are the possible solutions are available, and they can refer or suggest to the patient. Individual could be helped to provide their contribution to the assessment and handling the right informations, and also it can provide support and advocacy to the client and responsive to people's changing circumstances of independence over time. Okay, and in another set, it can improve the patient's independence within the during the period of care from dependence. It will help to move the patients to make all their activities in an independent manner. right? So these are the importance or the benefits that we can gain in the assessment process, because all these, so once you start to work in a collaborative manner, actually all the informations you can gain. So why we are gaining much information? So how much you are gain will be useful in your care planning and your care management, and you can provide your care effectively, and you can make your client will be feel very happy, comfort, and to improve the quality of care. So for all these things, we need to have this collaborative working in order to support and influence the assessment process positively. Okay, so this is regarding that. So that's all about today's session. So if you have any questions, you can ask now regarding today's lecture.
Excuse me, ma'am.
Yes.
These all are the things we cannot see now in our health sector. I mean government.
Yeah,
They are working uh, losing their interest norms.
yeah. Yeah, actually, your point is also correct. In current situation, we can't expect all these things from even from all the healthcare professionals, because as you said, it's right. Any profession, we need to have some interest first. We need to love our profession, and we need to have interest, because there are some people who work because they choose that job, right, without interest, because of any of their personal instances they choose, and they are thinking that okay, I choose because of instance, and I came to this job, that's why we are working. So that is the major concern. Yeah, it is the most of in our mind, it's prevailing even in student period also. Even some nursing students, nursing, I mean, I'm talking nursing, they also become a students due to some kind of forcing, some instances. So they become, and they are not like to work as a nurse, but with some instances they are becoming nurses. So in that situation, we can't expect that they would be a perfect one, because they starts to shows their disinterest in their working. In that manner, they work only like a task oriented, but not all. But as you said, yes, we can't expect, not only in the public sector, even the private sector also, we can't expect these more. Any other doubts?
No doubts, ma'am. Your lecture is all clear. Thank you for it.
Thank you. And what about others? I think only 4 of you are here. So others also cleared or not? Okay, I think others also not having any questions. So if you have any questions, go through the lecture note and recording. And if you have any questions, you can contact me personally or you can ask in the tomorrow session as well. Okay, so we'll wind up the session now. So have a good day. Bye.
Thank you, ma'am. Have a nice day too.